Good afternoon, colleagues, and thank you for joining our Champions webinar this evening with Dr. Madhu Pramanuji, Consultant, Birmingham City Council Public Health. Just our usual housekeeping, please keep our mics on mute. Please do use the chat function to ask questions or make comments or to indicate that you'd like to voice a question. You can also use the virtual hand to indicate that you'd like to ask a question. The call is being recorded just so that it's for minutes and accuracy purposes. And I've posted the agenda on there. I've got a colleague who's not going to stay on for long. He needs to go. I can't remember what he said he's doing. He's doing something, he can mention it. Thomas is going to come on first. He's going to just discuss a proposal with yourselves to see if anybody's interested in participating in something that Birmingham Museum would like to do. Then we've got COVID update from Dr. Madupe. Then we should have Dr. Okunku that's joining to discuss GP access issues that some of you raised a couple of meetings back. And then the business and data next meeting is Wednesday, the 29th of September. I'll hand straight over to Thomas. I know he's really busy. Thomas, over to you.
Hi, excuse everybody. I've got my gym kit on. I'm going to boot camp afterwards.
That's the one. Boot camp,
yeah. So I'm going to get straight to it, and absolutely, we have a great opportunity for people. So, Life in Lockdown, who are part of Birmingham Museum Trust, what they're trying to do is do a project to collect material, culture and testimonies that is associated with the COVID-19 pandemic and its legacies. So in May 2021, a new display at the think tank was launched, and it focused on the digital collection that we conducted through the first lockdown. And you can see that through going onto Birmingham Museum's website. So this project will include oral testimonies with Birmingham people, and we hope to conduct a range of interviews with people from across the city and capture the diverse range of the experience. So what is oral history? So this is a method of conducting historical research through recorded interviews between a narrator with personal experience of significant events and a well-informed interviewer, with the goal of adding to the record and to record that for history. So everybody has a story to tell, and every story is unique to them. And therefore, the oral history testimonies are really important, as it captures people's lived experiences through major events and everyday life. So the interviewer will prepare sets of questions for people prior to the interview, and they're designed to help you through the conversation and think about the interview prior. Now, there's no right or wrong answer because it is lived experience. Nothing will be challenged. It is an open environment, and we just want to make sure that we capture as much as we can about the time that we're living in. If you decide to put yourself forward, you have the right to decline any line of questioning. And throughout this, we want to make sure, and the Birmingham Museum Trust will make sure that you're comfortable, it's quiet, and there's no room for interruptions. And the interviews last around 20 to 40 minutes. So why do we want to do oral history? So what it does is it preserves in its entirety, and there'll also be a transcript of supporting information, and there may be photographs or objects that are being collected as part of the interview. What will happen though is prior to the interview, the interviewer will be asked if they're happy to assign the copyright over to the Birmingham Museum Trust on behalf of Birmingham City Council. What that copyright does is it enables the museum to make the interview accessible for research purposes only as a resource. So oral histories can be used in different ways, from the full interview for research, extracts being used as part of projects in galleries or online. And just so you know, the museum follows a set of ethics when editing extracts from the interviews to ensure the person's account is not taken out of context or misappropriated. So what I also learned by doing this is that the city has an active archive, and we have around 1,400 pieces, and it was established in the 1980s. And there's lots of topics on offer, including the First and Second World War, migration, industry, childhood, as well as specific neighbourhoods, including Digbeth and Handsworth. So what we're looking for is a couple of people to come forward to tell their stories, and those stories will be kept for future reference. And we're not talking 10 years, 20 years. We are looking at maybe 100 years time. The difference about the COVID ones and the more modern day ones is we're trying to capture that emotion and that feeling as we are living that experience. Whereas you can imagine in the 1980s and the 1990s, looking at the First and Second World War, it's reminiscent about those times and those days. So it's not as accurate as raw, and doesn't capture it as in good quality as we can do with COVID. So that's all I need to say on that, and I'll pass back to Habib. And if anybody is interested, please drop him an email or however he wants to be contacted. We'd love to hear from you.
Thank you for that, Thomas. Anybody got any questions? I know Thomas has got to go to boot camp. Anybody got any questions quickly for Thomas before he disappears? No, that's great. If anybody is interested, please do contact me. It's a really, really awesome opportunity for us to kind of like record history as we live in it. And as Thomas says, it will be recording the archives, and maybe 100 years down the line, somebody could read your story, my story, what it was like for us to live during COVID. I don't think Thomas mentioned that, you can, if you wish, you can be anonymized. Your name doesn't have to be mentioned or anything. It's just your story. That's what will be mentioned, and not your name. And also, the recording would be a live recording, and as Thomas explained to me yesterday, your ooming and your ahhing and all of that, it just stays as it is. So it's really live. It's not edited in any sense.
Thank you for mentioning that, Habib, because I did also forget to mention that you will also get the chance to listen to this before it gets handed over. And if there is anything that you want taken out, absolutely, it can be arranged, but we want it to be as a one take. It won't be stop-started, it is one take. So between 20 and 40 minutes, it can be facilitated face-to-face, ideally, or over Zoom or over Teams, but it would be with the Birmingham Museum Trust, not from people from Birmingham Council. So they are experienced in doing this, and you're in very good hands.
Thank you, Thomas, and I'm sure please do take up the offer, and it'd be excellent, for our citizens and our champions to be able to record what life is like during COVID, so somebody else maybe 100 years down the line can kind of like read that lived experience, just like how we go into the archives and maybe read about World War II or the Tudor Wars or something that happened 150, 200 years ago. It'd be a similar kind of thing. Thank you, Thomas.
Brilliant.
Thank you for your time. And
thank you, everybody. Enjoy your meeting.
Thomas. Thanks. Thank you.
Thank you. Bye-bye.
Okay, without any further ado, I'll hand you straight over to, I'm glad to see Dr. Okunku has also joined us. She's going to be next on the agenda after Dr. Mudupe. Thank you very much, Dr. Okunku. I know you're in clinic and you're giving up your time, so I really appreciate that. As per usual, you never let me down. Any request that I make, you're always there. You're better than my GP. Over to you, Mudupe. Shall I bring up the dashboard, Mudupe? You're on mute, Mudupe.
Sorry about that. Yes,
no,
please.
Let me just bring up the
Good evening,
dashboard.
everyone. Hello, Dr. Kokwa. It sounds like Habib is joining your practice, if you'll have him.
1 second, Mudupe. I'm just getting you on slideshow. There you are. Can everybody see that? Yeah, go ahead. Over to you, Mudupe.
Brilliant, thank you. I won't spend too much time on the slides because they will hopefully be up already on the website, and you should have received the newsletter. So we'll just talk through the highlights and then give you an opportunity to spend most of the meeting perhaps feeding back about what's going on and asking any questions as well from us that you might have from your interactions. Thank you to everyone for joining this evening. The data we have here shows that our number of cases have dropped again this week. So similar to what we saw the previous week, from the 6th to the 12th of September, we can see that there's been a drop from 3,248 cases to 3,069 COVID-19 cases or positive tests. When you look at the case rates, again, that's dropped from 284 per 100,000 cases across the city to 268 per 100,000 cases. As we mentioned last time as well, what we feel pretty pleased about is the fact that our testing rates have gone up. I think that arrow has been green. That third arrow has been green and stayed that way now for at least 2 to 3 consistent consecutive weeks. And that's really promising. I think it's the first time I've seen it that high. So we now have about 9,580 persons per 100,000 tested with PCR and LFD tests, which is really good. And I'm sure that this week, with the schools returning, that's contributed to that significant rise that we're seeing. It's also really promising to see that the proportion of these tests that have been carried out that are coming out as positive has dropped yet again. So that's again something we've seen happening consistently in the last couple of weeks. It's dropped to 13.5%, not a huge drop, but still it's good to see the arrow going in the other direction. When we look at hospital admissions across the city, we've seen a decrease this week of the number of people in hospital with COVID-19. The range is about 21 to 57 new cases or positive admissions in hospital. And that equates to a drop of about 6% compared to the previous week. Sadly, we had 11 deaths, a slight drop from the week before. So that's really, in summary, what's going on in terms of the case rates. And we know from the next slide, please, we know in more detail what wards are most affected, as well as the age groups. So the next slide, the colors have changed slightly on the slides. So you'll see there that across the city, when you look at which parts of the city are most affected, on this occasion, compared to previously, I think it's the white dots on the map. So the white dots are the ones that show you the rates that are highest across the city. So those rates are up north. As you can see, we've got a couple of wards there and a couple at the bottom as well, and just Oscott to the left. So that's what we can see there in terms of the wards that have higher rates. The blue, purple might be what others may be seeing. Wards are the ones that are the next highest group of wards with higher rates of infection. And when you look at the list on the left-hand side, Kings, North and South, with an infection case rate of about 433 per 100,000, now currently tops the list of wards with higher case rates across the city. As we've said before, this may not necessarily suggest that this is the case in reality, because it all depends on how much testing is going on across the wards in the city. So we look at this data with a bit of a caveat or caution, and just remind ourselves that some wards might be testing more than others. And the list goes all the way down to Sutton Trinity with 335 per 100,000 cases. And when you look at these top wards with highest case rates, as you can imagine, the main challenge for us is that their rates of infection are much higher than the citywide rate of just over 250 per 100,000. So there's clearly inequalities there, and we continue to work with everybody in the community to try and minimize the impact of COVID-19. When we look at the case rates in the age groups, this is the first time we've seen in a while that the younger age groups have a higher case rate than they did in the previous week. So for the 0 to 19 age group, we know that's increased in that age group. And this week, actually, I know from some of the data I looked at earlier that they have the highest case rate now in the city. the 0 to 19-year-olds, and that's largely because there's more testing going on in schools. If we go on to the next slide, and then I'll hand over. Well, actually, is Dr. Okonkwo doing a vaccine update? She's not. Am I doing the vaccine one?
We can. Dr. Okonkwo has come to do the GP.
She wants to do it. Yeah.
Yeah, that's fine. She can do the vaccine as well. Yeah, go ahead. You finish up the Mudipa, and then
Okay.
Dr. Okonkwo can do the vaccine.
All right, brilliant. So I just wanted to say, just wrapping up that across the city, what we are seeing as we continue to monitor is that people are clearly still proactively testing, which is really good. So taking an LFD test if they have no symptoms, organizing a PCR test if they have the 3 COVID symptoms, or if they've been told by test and trace that they're a contact of somebody who's tested positive for COVID. So that's really reassuring, because that's the only reason why our testing rates are going up. So we continue to encourage everyone to take that individual responsibility, that personal responsibility, to continue testing as we come to terms with living with COVID-19. And on that note, I'll hand over to Dr. Okonkwo. Thank you very much.
You want me to keep the
Sorry,
vaccine?
Modupe, I'm not sure. Yeah, you're doing the vaccine. I'm doing access to GP.
All right then. if you insist, I'll do the vaccine. Not a problem. So
Let me bring it back
the
up again.
vaccine slide.
Yeah,
Thanks, Habib.
I'll get that back again. Sorry,
Thank you. So whilst Habib is...
I tried to get your active Mudipa, but I couldn't.
I know. We have the expert in the room. So one of the things that we're looking at now with the vaccination, as we've all heard, so 2 days ago, the announcement was made that the 4 chief medical officers across the UK have unanimously agreed that 12 to 15-year-olds will be offered 1 dose of the Pfizer-BioNTech vaccine. So a lot of work is now being done to support the schools who will be supporting households and the children who will be eligible, the healthy children. And so this data won't obviously reflect that yet. I thought I'd start off with that because that's topical and very current and very relevant to a lot of what's going on the ground. When we look at the data across the priority groups, as you can see, our NHS and social care bars, the bar charts have been increasing ever so slightly since the last time we looked at it, and the imminent offer to social care to make it mandatory for people who work in care to have the vaccine, I think is having an impact on that. We hope that those in care who can have the vaccine can continue to make an informed choice when the offer comes to take the vaccine. Those who are at COVID risk and those who are clinically extremely vulnerable as well, I can see that those rates have gone up. In fact, clinically extremely vulnerable is now much better than the NHS and social care, which wasn't the case before. Older generation as well, I think we now have over 90% who have had their first dose across all the 3 much older age groups from 70 to 80 plus. And so as you work your way through the list, we still find though that in the younger adults, the 30 to 39 particularly, and the 18 to 29, the uptake in those age groups still remain a bit slow in progressing. So a lot of the work that the NHS are doing to reassure people to also make vaccines available to people who may still be struggling to access the vaccination will continue. Everybody across all the age groups, doesn't matter if your age group is not being called at the moment, everybody can still pitch up and say, I've changed my mind, or I'm now ready to have the vaccine. So please continue to spread the word about the different areas in which the vaccines, the vans and all the different community pharmacies and GPs that are able to offer vaccination to everybody. As we know, the announcement's also gone out that 50 plus age groups will be offered the booster, and that's also in progress. So again, very, I think will be very helpful for us to understand what the feelings are on the ground, the reactions to taking the booster. And just finally, for the younger ones, the 16 and 17-year-olds are also being offered the first dose. We know that we're hearing some feedback about concerns around fertility, myocarditis, and we've spent some time even today speaking to schools leads about what we understand about the risks. And much of the evidence suggests that myocarditis, and I'm sure Dr. Okoko can help a lot more with this, is much more evident in the vaccinated group when they take the second dose. So currently, only the first dose of the vaccine is being offered to 16 and 17-year-olds and to the 12 to 15-year-olds. And one of the things we discussed with the schools today was we emphasized the advice from the CMOs that we shouldn't stigmatize people who are not willing to take the vaccines just yet, who are still thinking about it and want more information. Rather, do tell us what people are worried about. If you share some of that insight with us, we're very happy to pull together the evidence to help them make an informed choice about taking the vaccine. So yeah, I think that's me done. The dashboard will go up on the website and you'll be able to see the full details on the slides, including which wards are still low on the vaccine uptake. Thank you.
Thank you, Mudipe. There is a question in the group chat. It's got a good question. I wonder if Carol would like to voice it rather than me read it out. It's quite a long question. Carol, would you like to voice it or would you prefer me to read it out? Okay, I'll read it out.
I'm just looking at the question now.
Sorry? That's fine, yeah, go for it.
Yeah, so it's why won't NHS England add the 3 to 4 most common symptoms to those symptoms, the key symptoms? So those less common symptoms of COVID-19, and sometimes they're called atypical symptoms of COVID. I think it's something that we flagged up, particularly as it came up, I think, in a lot of the schools outbreaks we saw towards the end of the summer term. Many children who later on tested positive had symptoms like headaches. Some even had diarrhea and other symptoms. And I think people highlighted to us that the World Health Organization website has a full list of other symptoms that we don't reflect on the NHS website. So it's something that's been flagged up through various channels. And when we had feedback from Public Health England, now OXA, we were told that this was being reviewed, but no directive had come yet from, I think it would be SAGE, isn't it? And those who make decisions about the criteria for COVID. So I don't know if Dr. Okoko has a bit more information on that, but I think if there is a suggestion to write to MPs, absolutely feel that we can definitely say that if champions feel this is something that is causing a lot of confusion or anxiety within the community, it's worth raising it to MPs, and we can ask for further clarity as well and come back to you if we hear anything from PHE.
Dr. Okonkwo, did you want to add on to that, or shall I ask if there's any more questions before I hand over to you for your part?
No, I don't have a lot to add. The problem we have is that we are very, how will I put it, monitored. They've got to be careful with what they are putting on out there. So the kind of information that they have to put on the website is something that they have to justify. So to be honest, that it's not there doesn't mean we don't recognize it. Most of the times for us as GPs, when you come to us and you talk to us about the symptoms, it might not be classical, but usually we use our experience and we still ask you to order a PCR test. It can be frustrating when you try to order it and it lists all those symptoms. But at the end of the day, that's where we are. And yes, I would agree with Modupe. If you feel it's something, maybe we should be writing to our MPs, because we do see a lot of unusual symptoms that you don't even attribute to COVID, but they can be. But at the moment, that's what they have on the website, unfortunately. So maybe it might be something that if you guys feel strongly, then we need to maybe take it up.
Thank you, Doctor. And one other thing to also bear in mind is that a lot of people with COVID don't have symptoms. I think, yeah, so that as well is something to bear in mind. I think from our perspective, from an infectious disease control, the test, that definitive test is the most important thing. And that's why it's reassuring to see so many people willingly taking a test on a weekly basis. I think that's what we need to continue to encourage people to push, so that we're not just relying on symptoms that are not reliable, because the test is I know even the tests are not 100% accurate, but at least they're much more, I think, reliable when it comes to diagnosis than the actual symptoms that this particular virus exhibits.
Thank you. Any other questions for Dr. Madupe before I pass you over to Dr. Okunku. So I can see another one. Oh, can disposable masks be reused if they are left for 3 days to allow any virus to die?
I think it's called disposable for a reason.
That's a no, then, yeah, Dr. Okunku.
I think that answers the question.
Yeah.
As it says on the tin, disposable. When you use it, we expect you to please kindly dispose of them.
Okay.
And just to add to that, that we do know that the guidance on face coverings and masks, and I don't know, Habib, if you've got that link, we can pop it in the chat because we haven't looked at that in a while. Sometimes people, because these masks are not cheap, I mean, I buy them online as well. I think I can understand the reason why, you know, sometimes people think, you know, perhaps if I leave it, I think my advice would be, and this is what the evidence suggests, that face coverings are just as effective. If anything, because you can wash them, it's that tendency to reuse disposable masks, as Dr. Konko said, they are disposable and should be thrown away. I think, in fact, so it's suggested on the packaging and the evidence after 4 hours, or if they're moist, they really are not as effective anymore. So you're better off getting a couple of homemade. I made some with my daughter over the pandemic last year, and I sometimes have about 4 in my bag. So I just swap them. And then when I've got a nylon bag, well, like a paper bag where I keep them. And then when I get home, I just hand wash them just before I have my shower, and then they're ready for next time when I use. So it's perhaps a lot easier to just use those face coverings that are homemade, and it's safer as well.
I've just put the link on there as well. Any
Thanks,
other
Habib.
No worries, you're welcome. Any other questions? Okay, maybe we can come on to any other business for anybody else. I'm going to hand you over now to Dr. Okunku, who joined us to answer some of your concerns. I know a few meetings ago, a lot of the champions, Dr. Okunku, raised issues around GP access and why they can't access them, and the inconsistency in terms of some you can go to, you can have face-to-face, others are doing virtual, others you have to phone up and you're waiting. And you know, those are the issues that our champions raise, some that they experience themselves and others in the interactions that they've had with the communities that they're living in and working with. So over to you, Dr. Okunku.
Okay, so I think if I can just quickly share just 2 slides PowerPoint, just to show. Yeah, I can. I'm sharing. Can you see that?
Yeah, we can see that.
Okay. Yeah. So I have to say, I understand everybody's frustration. And I think the problem we have here is the fact that there's been changes, and those changes haven't been communicated to a lot of us. It's only if you're in the system that you will understand why things have changed and what is going on. First of all, I have to acknowledge this was done by a friend of mine who sat down and put it on. And since she's done this, there's been more people joining our team. Our teams have changed. And I know over the pandemic, because there was the lockdown, a lot of people did not realize that these changes were taking place. For us now in general practice, it's not just the usual people that you would normally see pre-pandemic. So normally before the pandemic, you see the doctors and the nurses and the healthcare assistants. Since we had something called the National DARES, which kind of allowed us to bring in some more what we call allied health, we have more people working and seeing people in practice. So we have things like physicians assistant or physicians associates, we call them. We have the paramedics who would usually come with an ambulance to come and see you. They now see patients in the surgery. We have medical students we're training. We have pharmacists who now see patients as well. They do things like hypertension reviews, asthma reviews. We have what we call the first contact practitioners, who are specialists more or less in things like musculoskeletal, so bones and joints and all that. They see patients. So we have quite a varied team now that sees everyone. So when you call your GP surgery, they might not necessarily put you to see your doctor or your nurse like you're used to. It might well be one of these other people. And trust me, they're all qualified. For us, like my practice, we use My Healthcare Federation. We're part of a federation. So they do all the employment for us, and they make sure that all these people are trained. Like I have my paramedic, she's trained to be a paramedic, but she's undergoing further training so that she can work very well in primary care. So they are very well trained, just like the rest of us. So please, if you're giving appointments, because I do get this sometimes, they'll say, oh, but it wasn't with the doctor. Why did I have to see that person? That is the nature of general practice at the moment, because we have so much demand and we really need to play to our strengths. Then in terms of appointments, I just thought this is another slide that she devised that might give you an idea. Honestly, things did not start with the pandemic, because everybody assumes that with the pandemic, then the online telephone consultation and all the online things that we've been doing came on board. Actually, that's not technically true. Before the pandemic, the government had been pushing for us to get the services online, because we recognize, I don't know if you remember, there was a time we had this whole hoo-ha about Babylon. GP at Hand is called in Birmingham. They were trying to bring in this online consultation because we know the world is changing. People are moving about and they want to be able to access health wherever they are. They don't have to physically go to their practice to do that. But then I think the pandemic kind of accelerated things. So now you have we are trying as much as we can as well to empower people. We're not saying we don't want to see you, but we want to empower people to self-care, because I think at some point we all kind of forgot how to look after ourselves. We started depending on pills and potions to look after us. So now we're empowering people to self-care. So when you go to book appointments, you will notice that on most GP websites, or if you access things like patient access, they have all these channels where they can direct you to how to self-care. But if you feel, well, I still need to see a doctor, then you've got to decide, is it an emergency? We in general practice, we do not deal with emergencies. We don't deal with, not when we say emergencies, don't get me wrong, we don't deal with heart attacks. We don't deal with strokes. Those kind of things, or you've had an accident and you've broken your leg or things like that, those belong to the hospital. And that's why we say, when you call us, you will hear that message that says, if you're having a heart attack or a stroke, please call 999, because that is where you'll be looked after. And these things are time sensitive. Calling your GP to see your GP, you're wasting time. So we say, please ring 999. However, if it's not a medical emergency, what we now do is, most surgeries you will find, even the ones that are open, unlike before, you walk into your GP surgery and you ask for appointments and the rest of them, we've moved all that on. Most times now people need to call. You call us or you go online. Some, like my GP practice, uses a system called Livy, where you go online, you put in what your problems are, and they book you an online appointment. Otherwise, some practices call on the phone, and when you call, they book you a telephone appointment with your doctor. So we are saying everything now, because remember, although the government has opened everything, the pandemic isn't gone. The pandemic is still there. We've still got the Delta variant still with us and all the other variants there is. And we are moving into the flu season, or we are in the flu season at the moment. You can imagine if we opened all the doors and just said, everybody come in, sit down, make appointments, the footfall will be too high. And what would that result in? People catching infections. That is the last thing we want to do. I can't think of how many GP surgeries I can count at the top of my hand that have that big a facility for people to be able to socially distance while they're in the surgery and be able to maintain all the rules that we need. It is impossible. It's just the simple, honest truth. So to keep everybody safe and also to protect the most vulnerable, so like the elderly, the young children, we have different, that's why we're trying to minimize the footfall in most of the practices. So you can still book your appointment either by calling on the telephone or going online. Your GP will get in touch with you. Sometimes we will call you first, we'll talk to you. I promise you, if we need to see you face to face for whatever reason, all of us, we never stopped. The only thing is that you might not see the same doctor. You might not see your usual doctor. You might not be sent to your usual practice, but they should be able to offer you face-to-face. Like my practice, we never stop seeing face-to-face. The only thing is you would have to come in through a certain door. You have to leave through that door so that we maintain infection control. But now we are seeing more and more people. So every single doctor in the building now is seeing patients face-to-face if they want to. So, but we will speak to you on the phone. Sometimes it might well be that we speak to you on the phone and we say, you know what, we want to see you, but we don't want to see you because the only reason we'll bring you in is we want to examine you. If I can't examine you over video, I can't ask you to link up with me on video and I can examine you, and then we conclude the consultation. If I feel I need to touch you, let's say I have to feel your tummy, or I have to feel or look in your ear or look in your throat, I will bring you down and see you in the practice. So we are doing all that. But sometimes some people have something called e-consult, where everything is dealt with on the online, where we ask you, send us pictures, we have a look at it, we find out what is going on, and we will sort it out. And sometimes it might well be that we talk to you on the phone and we know that you're housebound, or you're in a care home. We reserve that because we don't have too many GPs, and we need to be able to see the people that are housebound and physically cannot come to the practice. So if that kind of thing happens, we would offer them a home visit and we will go and see them. So in a nutshell, what I'm saying is your GP is open, but the thing is, things are different. Is it ever going to go back to the way it was before, where we were wide open and everybody walked in and walked out? I don't think so. Because the last thing you want is we open all that up, people are walking in, then we have a COVID case, then we have to shut the surgery down and have to deep clean and do all that. That means that the rest of the people do not have access to us. And if you're coming to your GP surgery, let's say they ask you to come in, please remember, we are still one of the establishments that we insist that people have to wear a mask and you have to socially distance, because the last thing you want is go to your doctor to get some help and end up catching COVID. And the other thing you will notice in some surgeries, we've divided them. So you might come through a different door and go out through a different door. And if you have certain symptoms, we might ask you to go to another surgery, what we call the red site, where they will see you. For my surgery, we are amber, so we'll see you if we need to see you face to face. And then we still do all the child checks and all the pregnant women checks and all those things, but we will not see just everybody. We wouldn't be able to do that because we don't have the space. So please just remember, we are open, but things are just slightly different.
Thank you for that.
And that's me.
Thank you, Dr. Kunku. Very comprehensive explanation of what's going on. Any questions for Dr. Kunku from anybody? I'm just going to check in the group chat if there's any questions. I don't see anything in the group chat.
I think I've explained everything very nicely.
Yeah, you must have, Doctor. You must have.
I put a question in the group chat.
Yeah.
If I could just say it then.
Yes,
go for it.
please.
Go for it.
You just sort of mentioned the different groups within the GP practice and mentioned pharmacies.
Yeah.
I know some pharmacies are with a GP practice, but others, like Superdrug Boots, I notice are offering flu jabs. Would information, if you had your flu jab there, actually go back to the GP, or will it be totally independent and not on your record?
No. It's all joined up. We are all joining together. If you remember, even the COVID vaccines are now being given by some pharmacists. So long before the COVID vaccination came on, we wanted, the drive about vaccinations is we try as much as possible to get it to where it's convenient for the patients. We used to do that long before the COVID vaccination came in, and we're doing it more. So part of that program was to get people to be able to go to a pharmacist, to a pharmacy, and be able to have their flu jab. And this, to be honest, this is the first year that I've got my flu jab before my local pharmacies. They all used to get their flu jab long before us. But the system is married in such a way that when you have your flu jab with them, I automatically get a notification to say you've had it, so that obviously I don't have to call you in a second time and give it to you. It is computer system, I have to say to you, because even the national spine for the COVID does fail sometimes, and we get some weird and wonderful things. But ideally, if it's working well, it should come automatically to our system.
Thank you.
Thank you, Dr. Kunku. Anybody else got any other questions? Read GP access for Dr. Kunku.
Habib, if nobody has a question, can I make an appeal to the group, because these are champions? Can you people please help us with the aggression to practices, to GP surgeries? Please, if you can champion that for us, that would be really, really helpful, because what we found is that the abuse that our staff are getting has gone up really exponentially recently, and it's quite understandable. People don't understand what is going on. Everybody's frustrated. People have waited so long to be able to either see somebody medically or their GP and things like that. And I can understand their frustration, and we do sympathize. But what I can assure you is if you actually look at the data and what I've said to you today, we are seeing more people than this time, 2019. And be aware that we've lost a lot of doctors as well, because over the pandemic, with everything that's gone on, people have reevaluated their how will I put it now, their priorities in life. And some have decided to resign and do something else. Some have stepped down from their normal job. So we are fewer of us doing the work, but all the practice with all the other people helping us, we are doing as much as we can. And with the online access, we're seeing way more than we've ever seen. But people maybe don't understand what is going on, and there's a lot of abuse going on in primary care. What the consequence of that is that the more people are being abused, the more we are losing our staff. You have some practices that have lost 2, 3, 4 doctors, reception staff, because they cannot just cope with the mental toll of all the abuse. So please, if you can help us champion that as well, to just say, we are doing the best we can. We know that in the media, a lot of people have been, it's been GP bashing. We've gone from GP clapping to GP bashing. If the more you bash us, the worse things get in the system. The more people leave, the less of us there to see people, and the worse the system is going to get. So please, try and be nice to your GP staff, especially the frontline staff, the admin, the receptionist. They can only offer you what they have.
Thank you for that, Doctor. I'm sure our champions will champion that message, and I know we've spoken in our team that we're going to get some comms out around that. We can share with the champions as well. Any other questions for Dr. Okonkwo? GP access from anybody else? No, if there isn't, thank you, Dr. Okonkwo. I know you're really busy, and you're in the middle of your clinic. Thank you very much for joining us as per usual. If anybody else has got any other questions after Dr. Okonkwo is gone, more than happy. There's another question, Doctor. Don't go yet. we just read this. Sorry, from Carol again. Should pharmacies and booths still be encouraging customer face masks and distancing? Signage is less in my local booths. Quite a few customers without masks and arrows. But Midupe can take this one. Arrows, if you need to go, that is Dr. Okonkwo. Arrows indicating one-way traffic, no longer on floor, or patients have to walk through whole length of shop to get their medication. So you get the gist of that, Midupe. Basically, there's very little COVID kind of measures in the booth that Carol visits, or the store that Carol visits.
Well, I think it's difficult. Thank you, Dr. Okonkwo. See you soon. I think it's difficult, because of the fact that, as we know, face masks are no longer a requirement based on the government announcement. So many people who choose to wear face masks do so because of their personal responsibility and all the awareness we've been doing to people, just to remind them that we're not out of the woods yet. But I think you're right. I mean, sometimes this could be people who have COVID and don't even know it. They don't feel very well, and they're going to the pharmacy, or they're walking, as you say, around the whole length of the shop to access their medication. It's perhaps worth talking to the pharmacist or somebody in booths about it. I don't know if that would help, but unfortunately, there's really not much we can do because of the fact that the guidance has changed around mask wearing in public places.
Thank you, Midupe. Any other questions? Anybody else? Anything relating to the presentation that Midupe did? How do people feel about, in terms of, has anything come up in your conversation interactions about vaccinations for the 12 to 15-year-olds, and also the booster that's going to go into effect from next week for the 50-plus-year-olds? Has anybody heard anything, or anything within your communities and interactions that you've been having? Any thoughts, feelings, any anxieties? If you do hear anything, please do forward them on to us. We're more than happy to address if people have got issues and concerns, whether it's with vaccinating 12 to 15. I know some of my colleagues did some excellent information slides for the schools today or yesterday, I think it was, to push to parents and children, just reassuring messages about the vaccine. And if there is any questions that you've got about the booster for the 50-plus-year-olds, then please do forward that on to us. If there's no other questions, any other business? Anybody else got any other business? I've got one. At the last meeting, we had a colleague from Public Health England that came and did a short presentation to yourselves about how successful the Champions programs have been nationally and internationally. As a follow-up, they were interested to do an interview with one of our champions, one of yourselves. So if anybody's interested, please do email me, and I'll put you in touch with Dr. Jane South and her colleagues. It is quite short notice. They need to interview somebody by next week, Wednesday, the 22nd. It will be obviously a virtual interview, and I think it's about half an hour, 40 minutes long. It's just a follow-up from the research that they shared with you. So if anybody is interested, please do get in touch, and I'll touch base with or put you in contact with Dr. Jane South and her team, so we can get that done. If you can help with that, that'd be really, really good, because the Champions programs nationally have been very helpful. They've been really good for us in terms of to get the messages across to communities, particularly communities that are probably harder to reach or don't engage as much. And yourselves has really helped to push that message out to those communities. So I think it's only important that that is acknowledged, and I think that's what Dr. Jane South is trying to do, is to acknowledge the work and the importance of the Champions programs or similar programs to this during COVID. So please, do get in touch with me if anybody's interested. And like I said, the interview needs to be done before next Wednesday, the 22nd. So please do get in touch. Anybody else got any other business?
Sorry, can I just ask a question?
Of course, yeah. Go ahead, Kate.
Sorry, with the booster, is there a sort of clear timetable, as there was kind of like the first time round? Excuse me, there was a kind of clearly set out timetable, so you knew what order people were getting things, just in case we get asked.
You want to answer that, Madhu, or?
So there's a link about the booster on the chat. I believe I saw that. We might want to put that in the newsletter.
It's in the newsletter as well. It's in the newsletter as well.
Oh, brilliant. Okay,
And
it's a really,
No, sorry, yeah, go ahead. It's in the newsletter as well.
Oh, brilliant. Thank you, Habib. It's a really valid point. I think we'll have to wait and get a bit more clarity about how the process will work, because as you know, the 12 to 15-year-old vaccination is also starting now. So there's quite a lot happening. I think most GPs might still be involved in the booster, because many are not involved in the 12 to 15-year-old vaccination just because of the additional requirements for that. I think that's being done primarily through the schools, with the CCG leading that. But I think with the booster, it might be that people will hear from the GPs like they did with their first doses, and then they will arrange an appointment via the GP. So I think what we could do is, once we have a bit more clarity, we can ask for that from our CCG colleagues or the NHS colleagues. We might be able to share something further in the newsletter. I'm just looking at the guidance now. I can't see anything there, and that's what tends to happen. The announcement will go out, but it doesn't really have the detail in terms of the practicalities of delivering it.
Sorry, Madhu, but just to add on to that, I mean, again, that's what we haven't published it officially. I did read something. It was in the Birmingham Mail to suggest that the priority order will be the same as when the original vaccine was administered. So you'd have the most at risk first. You have that list 1 to 9. So those that are like, is it 75 plus or something, that was first. But it is, like I said, it's not a 100% bona fide source. So as Mudipe says, once we know from official sites, then we can share that with you. but I got a feeling it most likely will be administered that way. You will get a call from the GPs, but it will be the most vulnerable first, and then number 9 on the list is 50 plus. That's how they get.
And to add to that, you're right, Habib. And to add to that, depending on when you had your second dose, I think they have to wait 6 months from your second dose before they offer you the booster. So again, I think it will follow that timeline, as Habib said. But I think more clarity will come out once the GPs, I believe, will need to organize themselves and agree who sends out letters to who. And I'm sure it will be based on the last date when people receive their vaccines.
But Kate, as soon as you receive information, we'll circulate comms with yourselves, so you can, if community or people do ask you, then you can clarify it. Thank you. That's a really good question. Anybody else got any other questions?
Wait for any other questions. Can I just point out as well, I don't know if you've mentioned that already, Habib, the autumn and winter plan, which you popped on the chat.
I'll put it on the chat. Yeah, I'll put it on the chat.
Brilliant.
Mention it, please. I'll put it on the chat. If you want to mention it, go ahead.
So there's, we've looked at it. We're still working through as a local authority what that means. But the main crux of it all is that we are coming to terms with living with COVID-19. And I think this will be the first autumn or winter that we're doing so with most of the eligible population nationally already accepting the vaccine. But as you know, in Birmingham, the number is lower than the national picture. So our take on it is that we just need to continue to remind people that we're not out of the woods yet, although there are now complete lifting of restrictions when it comes to interacting with other people, and which is how COVID will spread. Largely, people still need to continue testing and following the isolation rules. And if NHS test and trace, contact them. We've been told that if people don't isolate, then the fines will still carry on. So I just thought I'd mention that winter plan, which is on the link on the chat. But again, please let us know if there's any uncertainty around that and what people might be saying or what it means for people as we move into the autumn and the winter. And I think the key thing is just continuing to remind those who may not have taken the vaccine about those risks to themselves and to continue to encourage them because we know the vaccines do work. Thank you.
Thank you. Thank you for that, Madupe. Any other questions from anybody else? Okay, if there's no other questions, thank you again very much. Thank you very much for joining again, giving up your time. The date of the next meeting will be 29th of September, 6 p.m. If there's any other topics or issues that you'd like us to discuss, or any other partners or professionals you'd like us to bring to that meeting or any future meetings, please do get in touch and let us know. Obviously, I know it's COVID, but there's also some other issues that have impacted as a result of COVID. And if it's something that you've experienced or you've come across in your interactions, then please do contact us, and then we'll try our best. Just like a couple of weeks ago, you raised the issue around GP access. Dr. Okonkwo was very kind to come in and explain how GP access works. And as she was explaining, the changes were happening pre-COVID, but because of COVID and everything, it all happened a lot quicker than maybe they would have wanted to do it. So everybody's assuming that it was as a result of COVID that they're not opening, whereas these are things that they were planning beforehand. But any other issues, then please do raise it with us, email us or contact us, and we're more than happy to bring in the appropriate partner or professional or stakeholder to come and explain and discuss with you. Other than that, thank you very much, everybody. Have a lovely evening. Stay safe. See you all soon. Thank you. Bye-bye.